So when we have diagnosed erectile dysfunction for a man, there's a number of treatments we can offer. For some men, actually doing nothing is enough. They may just want to know why they have the problem, they're concerned there is an underlying cause that's serious, and once we can reassure them, perhaps they don't necessarily want to have any treatment. However, most men do. Lifestyle changes, that is losing weight, stopping smoking, having your blood pressure controlled, managing your diabetes, very important, not just to help the erections but also for general health. And some men will get enough recovery if they get those things in order. Most men, however, will need treatment, and the mainstay of treatment are oral medications called PDE5 inhibitors, and these are the drugs that many people will have heard of, Viagra and other brands. They will work for perhaps 50 or 60% of men. These drugs open up the arteries in the penis to get more blood flow into the penis. For men where those drugs don't work very well, we have other options. Some men are happy to learn to inject a medication into the side of the penis themselves. That's a medication that opens up the arteries and causes an erection. We can sometimes use an external vacuum device to cause an engorgement of the penis with external suction. And then we have what I would regard as the gold standard treatment, and that is a penile implant procedure. And a penile implant is the only way to actually restore a man's erection. The other treatments are really about enabling him to get an erection, and a penile implant operation restores his erection.